Welcome to aminacademy.com. In human anatomy and physiology, let us discuss about disorders of nutrition. The importance of nutrition is increasingly recognized as essential for health, and illness often alters nutritional requirements. First one, protein energy malnutrition, PEM. This is the result of inadequate intake of protein, carbohydrate, and fat. It occurs during periods of starvation and when dietary intake is insufficient to meet increased requirement. For example, trauma, fever, and illness. Malnutrition is relatively rare in developed countries except when there is an underlying conditions. For example, sepsis, trauma, surgery, or a concurrent illness. Undernutrition is seen where poverty is prevalent and is usually the result of poor diet which is not adequately balanced. If dietary intake is inadequate, it is not uncommon for vitamin deficiency to develop at the same time. Poor nutrition reduces the ability to combat other illness and infections. Kwashiorkor. This is a malnutrition with edema that typically occurs when breastfeeding stops and is often precipitated by infections such as measles or gastroenteritis. Next one, malabsorption. The causes of malabsorption vary widely from short-term problems such as gastrointestinal infections to chronic conditions such as cystic fibrosis. Malabsorption may be specific for one nutrient. For example, vitamin B12 is pernicious anemia, or it may apply across a spectrum of nutrients, for example, tropical sprue. Obesity. In developed countries, this is increasingly common, although it is also prevalent in some developing countries. The WHO defined obesity as a body mass index that exceeds 29.1. It is obesity. It occurs when energy intake exceeds energy expenditure. Example, in inactive individuals whose food intake exceeds daily energy requirements. When the hormone leptin is associated with obesity, it has several functions, one of which is control of appetite. After eating, this hormone is released by adipose tissue and act on the hypothalamus, resulting in a feeling of satiety or fullness, which suppresses the appetite. In obesity, there are usually high blood levels of leptin and the negative feedback system, which usually suppresses the appetite, no longer operates normally. Obesity predisposes for cardiovascular diseases, for example, ischemic heart diseases, hypertension, type 2 diabetes mellitus, some cancers, hernias, gallstones, varicose vein, osteoarthritis, increased incidence of photoperfusion complications. Conditions with dietary implications. In addition to malnutrition disorder, there are many conditions where dietary modifications are needed. Now we'll discuss further detail about disorders of nutrition. The disorder of nutrition are healthy conditions resulting from deficiency. Disorder of nutrition are health conditions resulting from a deficiency. Excess or imbalance of nutrients impacting the body's anatomy and physiology. These can range from undernutrition, that is malnutrition, to specific deficiency diseases to overnutrition related issues like obesity and associated chronic diseases such as type 2 diabetes and cardiovascular diseases. The consequences include digestive, skeletal, neurological, and other schematic functional disorders. Causes: deficiencies, insufficient intake of essential nutrients like vitamins, minerals, protein, etc. Excesses, consuming more nutrients than the body needs, which can lead to toxicity or obesity. Imbalance, an incorrect ratio of different nutrients such as saturated versus unsaturated fats. Malabsorption, the body's inability to properly absorb nutrients from food. Some types of disorders: undernutrition, protein energy malnutrition. Examples include marasmus and kwashiorkor, which can cause facial and body wasting. Deficiency diseases: scurvy, that is vitamin C, rickets, vitamin D, pellagra niacin, xerophthalmia, vitamin A, and anemia iron. These are the some deficiencies diseases. Overnutrition, because of overnutrition, obesity. The state of excessive body fat increases the risk of chronic diseases. Nutrient toxicity, harm caused by excessive intake of certain vitamins like fat soluble vitamin A and D or minerals. Diet related chronic diseases, conditions linked to long term poor nutrition including coronary heart diseases and stroke, hypertension, type 2 diabetes, certain types of cancer, osteoporosis. These are the diet related chronic diseases. Impact on anatomy and physiology, structural damage. Long term deficiency can lead to structural changes in organs and tissues, functional impairments. Nutritional imbalances affect the proper functioning of body system, including the digestive, nervous, musculoskeletal, and circulatory systems. Neurological signs. Disorders of the nervous system can be a result of or contributor to poor nutritional status. Increased mortality and disability. Poor nutrition is linked to increased mortality, frailty, functional decline, and reduced quality of life. So far, we discussed about in human anatomy and physiology. In that, we'll discuss disorders of nutrition. We have done. Please subscribe our YouTube channel.